Okay, let's finish this up for the contraindications. Compromised immunity. Anyone who has a compromised immune system, you need to take extra precautions when working with these clients, whether they're ill or elderly, whether they're getting chemo or radiation, any other factor that limits their immune function, HIV, of course. And the idea is, I want you, first of all, to remember that chemo is not just for cancer. That people have chemotherapy for a lot of conditions, a whole host of conditions. So, kidney issues, I'm trying to think of some examples. The important thing is that if you're working with somebody who's having chemo or radiation, their immune system is suppressed, they may have a port that's surgically implanted up by their shoulder. You certainly want to be careful around that area. But in addition to that, you want to make sure that you clean your doorknobs, your light switches. The bathroom needs to be impeccable. You need to wipe down the armrest, things that you typically wipe down after each client. You want to make sure that you pay extra attention, that they are thoroughly clean, and that you are not carrying anything. You haven't been exposed to, your kid has strep throat, but you don't have any symptoms. You wouldn't want to meet with someone with a compromised immune system in that scenario. If you have been around someone who has a respiratory disease, sometimes when I've worked with clients that were receiving chemo, I've just let them know. Someone at my office has recently had, a cold, and I wanted to let you know. It's up to you if you want to keep the appointment. And you want to take every single precaution you can possibly imagine if they have a compromised immune system. They are taking a much higher risk by coming to you with their immune system suppressed than you are by being around this person, whether their condition is contagious or not. Osteoporosis. Avoid deep pressure and vigorous joint movements. This should go without saying. If somebody has osteoporosis at any stage, you wouldn't pull traction on a joint, you wouldn't use excessive pressure. Please understand that at its advanced stages, a person could sneeze and break a bone. So this is Swedish only. Massage can be a benefit to them, but you do have to be careful. And cancer. The only concerns with cancer right now, there were a lot of concerns in the past about cancer. We didn't know if massage would cause the cancer to spread, especially for different types of cancer. We now know that it does not cause it to spread. However, they do typically have a suppressed immune system due to their treatments. So you would need to make adaptations, make sure you get the approval of their doctor. Okay, I think that's it for it. That's all for contraindications. Let's talk about adaptations you would make for medication. Again, this is by principle. I don't expect you to memorize every medication out there and both the common name and the less common name and, all of that and what they're used for. If I give it to you by principle, you can look up the medication if you're unfamiliar with it, and at times I just ask my clients, why was this prescribed? What are you taking this for? So let's talk about scheduling the session. Massage after the client's scheduled dosage if the medication is needed for stability. In other words, an insulin-dependent diabetic or an epileptic patient. You want them to take their medication before the massage. Massage shortly after the scheduled dosage if the medication decreases the client's perception of pain and his or her ability to give accurate feedback. So anyone taking pain medication, central nervous system depressants, anything like that, it's going to affect their ability to tell you that hurts, I'm uncomfortable, and you won't get the feedback that you need during the session. So you want to schedule the massage for right before they take their next dosage or immediately after they take it before it's really been absorbed into their system. Session length. You want to shorten the session if the medication will deplete the energy level of the client, causing fatigue, like taking hypertension medication or anti-anxiety drugs, antidepressants. You want to make sure that you don't keep them on the table too long. You also want to shorten the session if the medication significantly decreases the emotional stability of the client, causing them to feel volatile or overwhelmed. Like corticosteroids for long term, or medications that have side effects that cause mood fluctuations, like antidepressants or anti-anxiety medication. And then lastly, we want to think about what strokes and techniques we would use with different medications. So for drugs that alter a clotting mechanism, that would be anticoagulants, platelet inhibitors, aspirin, other non-steroidal anti-inflammatory drugs. You would definitely want to avoid high-pressure techniques like muscle stripping, deep kneading, ischemic compression, cross-fiber friction. For drugs that alter their protective responses, which would include centrally acting muscle relaxants, narcotics, anti-anxiety drugs, avoid deep massage, PNF stretching, which would fall under tense relaxed stretching, and any technique that requires accurate client feedback for safe application. Any drug that compromises tissue integrity, that would include corticosteroids, long-term use, or anything that was directly injected into the joints or tissues. You would want to avoid pressure techniques, heavy tapotment, forced stretching, skin rolling, ringing, and for any drugs that mask the pain response, which would include anti-inflammatory drugs, analgesics. You want to definitely make sure you rely less on client feedback, more on observation and palpation, and you want to lighten your pressure and watch your techniques. Okay, that's pretty much it. So that's a lot to bite off when you don't really know what you're doing with massage. But again, I think it's important to give this at the front end. I hope that you all are going to find this helpful and that you will review this, especially when you're going through concepts of disease and you're thinking of different conditions that you may encounter. All right, I will see you all in class.